So, welcome to part two of the reasons why pregnant women should understand and know the face of preeclampsia. So, these are some of the health coaching questions that I would ask my client to make sure she understood the condition and plan of care. The first thing I would ask is what was the conversation between her and the healthcare provider? Okay. Because receiving a diagnosis like this, especially for the first time, it is scary, it is stressful. So, a lot of women may have not heard the conversation. And for some women, they may not necessarily feel comfortable with asking questions or just honestly, just completely overwhelmed by the diagnosis. So, that's the first question I will ask. So, next, I will ask more specific questions such as what is the understanding or what is her understanding of preeclampsia? So, such as signs and symptoms associated with preeclampsia. Also, does she understand the risk to her, the baby, and future pregnancies? And also, does she understand what the plan of care is? So, some of the symptoms associated with preeclampsia would include headaches, visual disturbances like blurry, spotty vision, also upper abdominal discomfort in the area of the liver. So, remember, preeclampsia can affect multiple organs, including the liver. Also, another symptom would include nausea, vomiting, and honestly, generally just not feeling well altogether. So, next, we need to know how the client will be monitored so that mom and baby are safe. So we want to know, what does the plan of care look like? What did her care provider talk to her about, such as home blood pressure monitoring? And does she know how to take a blood pressure? Also, symptom monitoring, like the headaches and the visual disturbances. Also, baby kick counts. That might be another thing that is part of her treatment plan. So, also, we want to know what the parameters. When should she call her healthcare provider? For example, her provider may say if your blood pressure is a certain number, you need to go to the hospital. So, we definitely want to make sure that's clear. Also, the plan of care would include more frequent visits with the obstetrician as well as a perinatologist. So, the perinatologist is a special doctor that cares for women during pregnancy. Okay, so this special doctor will provide the client and the doctor with recommendations on how frequent she should visit, as well as how often she would need blood work and ultrasounds. So, ultrasounds help us to monitor the growth of the baby, the blood flow through the umbilical cord, also the health of the placenta. And at some point, her healthcare team or the healthcare team will want to monitor the baby's heartbeat to look for certain patterns in the heart rate. So, we just want to make sure she's all clear on this. Also, the perinatologist, that special doctor, will be the one to go into great detail about the risk to her, the baby, and future pregnancies. So it's definitely a multidisciplinary approach here. They will also discuss possible treatment that she may need, one, to prevent seizures and to lower blood pressure. And they will also talk to her about the timing of delivery and much more. So, also, as you visit your healthcare provider, you should encourage the client to feel free to ask questions about complementary treatments in conjunction with the current regimen, such as yoga. And if this is okay, make sure you go to someone who is skilled and understands the condition. Also, you can inquire about supplements. But honestly, this option is probably more reasonable as a preventative measure, but it doesn't hurt to help because you never know what current research is out there. So, ask the questions, don't be shy. So, well, I hope this helped, and thank you so much for watching. Please like the video. Thank you. See you in the next one.